So let's talk about these diseases that are being prevented through immunization. And let's start with tetanus and then we'll go to polio and then we will continue. Tuberculosis, which in short is TB, it is caused by a bacteria which attacks the lungs, and other parts of the body can also be affected. And if tuberculosis is not treated, it can kill. It can be spread through coughing or sneezing, especially when you are in a crowded area. And symptoms they include fever, body weakness, night sweats, we have chest pain, weight loss, cough, yeah. And if you notice this in a person that has been having a cough for more than 2 weeks, you're supposed to refer this person to what? To a link facility so that they can be checked. So let's talk about polio. This is poliovirus, and then poliomyelitis is a disease caused by a virus called polio. It is a creeping and potentially deadly infectious disease. Again, when we talk about polio, it can be spread through ingestion. Ingestion, this is when, for example, you are taking food to your mouth, of infected feces through contaminated food or unwashed hands. The symptoms they include sore throat, we have fever, we have tiredness, nausea, headache, and stomach pain. And then look out for any child less than 15 years of age with a sudden onset of weakness of the limb not due to injury. So this is a person whereby you find that they are feeling very weak in their limbs, but it's not that they have any injury. So let's talk about this other disease called diphtheria. Diphtheria is a bacteria caused thick covering in the back of the throat and ulcers on the skin. Sorry. It can lead to difficulty in breathing, heart failure, paralysis, and even death. So symptoms they include neck and respiratory obstruction. It spreads in droplets and secretion from the nose, throat, and eyes in the infected person. So those are some of the diseases that are being prevented. Let's continue. We talk about whooping cough. This is mostly common. It is a highly contagious respiratory disease that affects people of all ages. It is spread through droplets, especially when a person sneezes, and for example, you are in a crowded area, and then characterized by uncontrolled running nose. This is when you are having running nose, and lung and long lasting cough common at night, which often makes it hard to breathe. You find like the nose is blocked and it's becoming difficult for you to breathe. And after fits of many coughs, one often needs to take deep breath, which results to whooping whooping sound. Yeah. So let's talk about tetanus. Tetanus is also common. It's spread by a bacteria present in soil, and for example, mostly it's found in fecal waste of animal and human, and not transmitted from person to person but through wounded contamination with dirt, dung, or ashes containing a bacteria, and in the umbilicus following non-sterile delivery. So that is, let's talk about the symptoms of tetanus. Symptoms of tetanus we have like muscular stiffness in the jaw, and then we have stiffness in the neck, difficulty swallowing. We have stiffness in the stomach, back muscles, and then we have muscles spasms. This is like triggered by slight irritation and in the nose. Yeah, check muscles pulling outwards, sweating, and fever. Those are some of the symptoms of tetanus. So let's look out for any newborn who is normal at birth, then between 2 days and 1 month is unable to breastfeed or has stiffness. So that child might have tetanus. Let's talk about rotavirus. Rotavirus disease is the most common cause of diarrhea disease among children worldwide. So when you hear about rotavirus, this is a vaccine that prevents a child from diarrhea, and it's spread by fecal oral routine, by contamination of food, water, environment, surfaces such as toys. And signs and symptoms, they include vomiting, which usually is followed by watery diarrhea that can last for 3 to 9 days, fever, abdominal pain, nausea, and fatigue. So when we talk about rotavirus, this is a vaccine given to children to prevent what? To prevent them from from yeah, to prevent them from diarrhea. So the vaccine rotavirus prevents diarrhea. So we are going to another disease that is being prevented through immunization, and this disease is Haemophilus influenza type B. Haemophilus influenza type B is a bacterial infection which normally causes meningitis and bacterial pneumonia in children. Meningitis is an infection on the brain or the spinal cord, leading to the brain damage, and it can lead to deafness. So Haemophilus influenza type B disease can cause severe swelling in the throat, yeah, making it harder to breathe, and blood infection, joints, bones, covering the heart, and even death. So it is transmitted from person to person through droplets, also when children share toys, yeah, and other things that they put in their mouths, yeah. So the risk of transmission increases when children spend long period of time in crowded households or daycare settings. So when you take your child to the daycare, there are so many high risk of getting Haemophilus influenza type B. So let's talk about hepatitis B. This is another disease that is being prevented through immunization. Hepatitis B is a serious liver infection caused by hepatitis B virus. It is easily preventable by vaccinated. Yeah. And if we talk about the symptoms of acute hepatitis B, they include, we have fever, abdominal pain, we have loss of appetite, nausea, vomiting, we have abdominal pain, yeah, joint pain, and jaundice. Jaundice, this is now when we talk about the eye turning to be like yellowish in color, yeah, and the skin, yeah, turning into yellowish in color. So it is spread through sexual activities and use of contaminated needles or syringes. So in short, sharp objects, yeah. And none of these symptoms are common in infants and young children. So that's all about hepatitis B. Let's talk about pneumococcal disease. Pneumococcal disease is also prevented through a vaccine prevention. So is the most common cause of severe pneumonia. Pneumonia, remember, it's infection of the lungs. And symptoms, they include fever and chills, cough, rapid breathing, and difficulty in breathing and chest pain. It spreads through droplets by sneezing or by coughing. Yeah, or by coughing. That's all about the pneumococcal disease. So let's talk about measles. Measles, I know most of you are aware of it. This vaccine is an acute viral infection caused by measles virus, highly contagious virus that spreads through the air through cough and sneezing by an infected person. It starts with fever, runny nose, cough, red eyes, and sour throat, followed by a rash that spreads over the day. And transmission occurs mainly in crowded homes, urban slum areas like places like Kibra, mostly, and we have congested places whereby you find in this place we have so many people staying in that place. So that place is a risk of measles, and look out for any person with any body temperature and a rash and take this person to the link facility. Yeah. Let's talk about this other disease prevented through immunization called rubella. Rubella is an acute contagious viral infection caused by rubella virus. It can be spread through airborne droplets. Again, signs and symptoms, they include rash, fever, nausea, and mild conjunctivitis. Yeah, that is it. So that's all about rubella. I don't have to talk much on it. Let's talk about yellow fever disease. Yellow fever. When we talk about yellow fever disease, it's spread through infections of mosquito bites. So that's why you are being advised you use mosquito net or mosquito repellents. Symptoms, they take 3 to 6 days to develop, and some of these symptoms, they include fever, chills, headache, backache, nausea, pain, vomiting, abdominal pains, bleeding, gums, and then we have blood in the urine, and then we have jaundice. Jaundice, I told you earlier, it's when the eye turns yellowish or the skin. And then lastly, not last but least, not least but last, so let's talk about vitamin A supplement. Vitamin A is important in boosting the immunity